So let's talk a little bit about the psoas muscle, also known as your hip flexor. The psoas muscle inserts on the lateral side of the vertebral body of the lumbar spine. It crosses here over the pubis and attaches on to your hip at the femur head. So this muscle is responsible for flexing your hip. This muscle is contracted on almost everybody that sits a lot for a living and everybody who runs. Obviously it's going to be contracted on a lot of people. When the hip flexors are tight, it'll have a tendency to create a pain in your back that's very abstract. Almost you'll want to point like this to your back, not really knowing a specific spot where your back or your buttocks are, pain is being generated from. A good example would be after a day of doing a lot of work in the garden where you're bending and twisting a lot and really utilizing that hip flexor, or if you're having back pain after a long run. So the way we're going to stretch that is called the kneeling psoas stretch. So we're just going to kneel down on the ground, ideally next to your couch or something that you can hang on to. We do want you hanging on during this stretch so it does not become a balancing stretch. You want to have something here that you can kind of grip. And the key is that your front leg is at a 90-degree angle. We don't necessarily want this to be a runner stretch. Although a runner stretch does do a significant amount of stretching, it does not stretch any one muscle very well. So we're focusing in this position on the left hip flexor. Front leg is at 90 degree, back leg is relaxed, and the movement comes from pushing this hip forward. You can pretend someone has a rope to your ASIS, the front of your pelvic bone here, and it's pulling you in that direction. As your hip tilts forward, you will have a natural angle back to your upper body. If you want a little bit more in the stretch, you can lean away from the side that's down, and you will feel that stretch intensify a little bit more up here into the thoracodorsal fascia. Okay, so then from the other side, we could just take that leg down, come back up. If you tend to run tight in your hip flexors, getting into this position, you might notice a natural lurch forward. This is not what we want. So pull yourself back up and push that pelvis forward. Sometimes if you're really tight, you might not feel it all the way up here in the hip flexor. You might feel it down in the quadricep muscle. So just keep working with it, and sooner or later you'll start to feel how this can release your pelvic girdle and really alleviate a lot of that pain coming from the lower cross syndrome. If this is too difficult on your knee, feel free to bring a pad or a cushion in on the kneecap